Good morning. It is March 13th, 2020, and I just wanted to make a little video to sort of update y'all on what's going on with us here in Costa Rica in regards to the coronavirus. Now, I'm not going to be sharing a lot of facts because I'm not a doctor or a scientist. I'm just going to be sharing what is going on with us and how it's affecting us and the country that we're in, just to give you a little bit of perspective. So, I'm not going to complain about life here in Costa Rica or about being a missionary. I really enjoy my life here. We have a lot of benefits and a lot of things that are different. Like we have a lot better off than a lot of other places. So I'm not even going to pretend that that's not the truth. We do have access to good medical care if we can pay for it, and of course we have access to a lot of goods and supplies. But Costa Rica is, I'm going to be honest with you, it's not a super clean place. It may look like it in the tourist videos and places you've seen, but where I live in the city, it's not super clean. When I walk the girls to school twice a week, I walk them to school and we have to pass giant piles of garbage because that's where it gets collected. So like twice a week on our way to school, we're avoiding walking around like on either side of the street, like big piles of garbage. There's animal waste in the street and in the sidewalk all the time. Yes, there are laws against that, but it doesn't stop it. So we're constantly avoiding stepping in that. And it's not just me when I take the girls to school. Sorry, you may hear Elijah in the background. He's upstairs with Jeremy. But anyways, it's also Jeremy when he's out visiting, when we going to people's houses and things. So, we already have to avoid a lot of uncleanliness. And then it's hard for me to share this, but the drug and alcohol problem is also very real where we live. There's a place just down the street from me that during the day it's okay more or less, but at night, at the park that's close to our house, it's where the people that do drugs like to gather. There are times when I've had to walk by someone smoking a joint, just right there in the street, or drinking alcohol. And it is something to contend with. So that being said, like that's our already normal daily life. Like that's what we're already sort of working against. Um, and also just wanted to give you like some facts about the size. I said I wouldn't give facts, but here's some facts. The size of Costa Rica and how densely populated we are. So there's about 5 million people in Costa Rica, and that's the land mass is about the size of West Virginia, but the majority of those people live in the metropolitan area and the greater metropolitan area, which is where we live. We live just outside San Jose City. And when I say just outside, when I walk out my door, go down the street, and turn the corner, I can see San Jose City. Like I can see the whole city because I'm a little bit elevated. And the population density there is about 17,000 people per square mile. That is a very high population density. Where we live, it's between 11 to 12,000 people per square mile. And we picked where we live because of our ministry. Like we chose to live in this area because it was so densely populated. So while, it's great for ministry, it's not so great in something like a pandemic where, you're trying to avoid close contact with everybody. And also when I say closely or, close to each other, my wall, the wall opposite me is my neighbor's wall. Like all of our houses are built right next to each other. Like my walls on both sides and in the back share with my neighbors. So I'm not, I'm not even like, I don't even have a yard between us. Like we're right with each other. If they're yelling, I hear them, that kind of thing. So, and thankfully I've got some pretty good neighbors for the most part. For the most part. That's a whole nother story, not part of this video. But anyways, I'm just trying to give you a perspective of how close we live to each other. When, and then when I walk out or when Jeremy walks out, we do a lot of walking. We have one car and we do use it for errands and things, but like a lot of what we do is on foot. And so we're passing people all the time. So anyway, so that just gives you some perspective of just how close we live with each other in this area. So also another exciting thing is right now we're experiencing water rationing. Like I'm getting text messages from the government because I have a Costa Rican cell phone plan. And so then they're saying, go wash your hands. It's the best way to prevent it, right? And then they turn my water off. And then we can't get hand sanitizer because it's sold out everywhere. Hand sanitizer and rubbing alcohol are pretty much completely sold out. Jeremy just happened to hear, he was at the store where he was trying to get some. They didn't have any. And he happened to hear somebody say, oh, there's going to be a shipment tomorrow. He showed up early. There was already 50 people in line. And as soon as they opened the store, the line went straight to where they sell the hand sanitizer, and they were limiting how much people could get. But we were able to get some, and the reason we decided we needed to get some was because of our ministry, which I'll get to later. But anyways, so now that you have a perspective of what it's like to live here, more or less, and how dense of a population it is, we have one lab in the country that is processing these coronavirus tests. One lab that is testing everyone that thinks they might have it, and they are at capacity. They cannot take any more. They cannot handle the tests that are coming into them. So to put that into perspective, 5 million people is in between the two biggest cities in the United States. New York has a little over 8 million, and Los Angeles has like between 3 and 4 million. So imagine a city the size of Los Angeles plus another million people. So like Los Angeles and maybe Jacksonville, Florida, having one lab for everyone that thinks they might have coronavirus. So at the time of this, I looked it up right before I started recording, we have 23 confirmed cases, 206 in process that they still don't know, they haven't gotten the results yet. And then who knows? Because of the way this can spread. This all started for us with 3 people, 2 that came back from Italy, and a man who is considered a super spreader who brought it back. He was in transition through Panama. I don't know his origins, but basically he had been in Panama and he came back. And he is the one who spread it to the majority of those 23 known cases. And they know those cases because they started going to his family members and saying, do you have any symptoms? Do you think you might be sick? And that's how they found those first confirmed cases. But who knows? He's a doctor, and he was in and out of a hospital seeing tons of patients before his diagnosis was confirmed. So who knows how many people he actually infected. So anyways, so that is how our situation is currently growing. And then here is the things that we have to consider now going forward. So first of all is the idea that we may come to a point where there is a scarcity of goods and things that we need. We've stocked up on food. Jeremy's probably going to get a little bit more because we may come to the point where we are forced to quarantine or we're told to social distance or stay, away, and so only do the errands that are important. We're not there yet. Costa Rica hasn't reacted as strongly, but it may come to the point where it's harder to get things, and we have to consider that. We, as missionaries and with BIMI, who have really good policies in place, like we have a sufficient amount of funds to go out and buy in advance. But our neighbors and our friends and the people that are coming to our Bible study may or may not have the resources to go buy what they need in advance. Here, it's very normal to go buy what you need for the day or a couple days, not to buy weeks and a month in advance. Most people just don't have the resources to do that. So we'll have to consider how we can help our neighbors and what happens, if things start to become scarce and it's hard to get food and supplies. Secondly, the medical system is already overwhelmed. It was already overwhelmed before this virus hit. They were already occasionally there would be strikes. The economy in this country is not that great. It's honestly on the brink of collapse, and I'm wondering if this is what will finally push it over. This country, Costa Rica, is very in debt, and they just don't have the funds. And of course, it's socialized medicine. Now, the way this works is that if you have a job, you can pay into the government healthcare, and then you will be able to receive care. Now, that varies, and it's not always the best care. Children have the right to receive care up to age 18, so all children will be treated, and the spouse of somebody who's working will have care. But beyond that, you're on your own. I think once you retire, you also are guaranteed care. But I've read that they're already having to turn people away who are seeking medical attention because they think they might have coronavirus because they can't treat everyone so far. As missionaries, we have the means and the access to the private hospitals. I have experience with 2 of the private hospitals in the country from when we lived here before, and they're good. I know that if we need to be seen, we will be able to go there. if they're not already completely overwhelmed. So, that's just something to consider. There's maybe 3 really good private hospitals, maybe 4 in the whole country. It's not like I can just go somewhere else and get care. And I, personally will be staying as far away from the public hospitals as possible right now, because it's just, that's where you would catch it, obviously. So there's that to consider. And then for our friends who, don't have the means to go to a private hospital, because it is very expensive. You have to pay upfront out of pocket. And so we would get reimbursed. Them, that money's just gone. They're stuck with the public system, and that's what they have. That's what they'll have. Lord willing, there won't be so many cases that are that grave, but the point is we have to sort of consider that as we go forward, that this medical system could get overwhelmed. Then there is the possibility that we will not be able to travel. One country so far has closed its borders. El Salvador has closed its borders to everybody except nationals and people with residency. We're in process for residency here in Costa Rica, but we don't have residency. So I don't know what that's going to mean for us if Costa Rica decides to close its borders. It could mean that we just can't leave, which is, that's a scary possibility for me. I'm going to be honest. The idea of being trapped and not being able to leave does scare me. Or the other option is that we are forced to leave because we aren't nationals and we're not citizens or residents. Like, we don't hit any of those criteria. We're technically still tourists. We are in process, but that process is a very slow one. And because of all of this, they've closed government offices and they've sort of put a cease on everything going forward right now. So this already slow process is slowed down even more. And on a smaller scale, in order to be able to continue to drive, for our driver's licenses to be valid, Costa Rica says that we have to leave the country every 90 days, regardless if we are in process for residency or not. Jeremy's 90 days are coming up at the end of this month. But if he can't cross into Nicaragua and cross back, which is what we normally do, we go to the border, we cross over, and we cross right back, and we come back home. And it usually takes a day. If he's not able to do that, he won't be able to legally drive until he can leave the country. And thankfully, I have about 2 months longer than him, because I just took that trip to see my grandmother, or to see my parents and go to my grandmother's funeral, not to see my grandmother. I didn't get to see her. But anyways, my point being, so I will be the only one in the family that can drive if that ban comes into place. It's just another thing to consider. And then also, there's the ministry to consider. For us, we're having a Bible study in our home. And so while we are going to continue and we're going to put measures in place to protect ourselves and each other, it is a little bit nerve-wracking to know that people are just coming into my home and they may be bringing this virus with them. We meet in the garage, but they do have access to the house because of needing to use the bathroom or whatever. We don't restrict that. But that was one reason why it was so important for us to try to get hand sanitizer, is so that we can share that. This past week, I offered my bathroom to anybody who wanted to wash their hands, and we have food. And so, to wash their hands before we had food, and only one person took me up on it. So if I put this hand sanitizer out, I'm hoping that people will start to use the hand sanitizer. And obviously, if it gets to the point where Costa Rica is saying, okay, you don't need to have any public gatherings, you need to keep yourselves isolated, then we'll consider what to do next. But that's a big consideration, because we are a fledgling Bible study. We just, we're only a little over a month into this. We have a small group that is forming and that is becoming faithful and stronger. And we just suggested to them and talked to them about the idea of starting a Sunday Bible study. And the reason it's a Bible study and not a church is because with our residency status, we cannot legally start a church until we reach certain goals, and which is why it's important for us to get residency as quickly as possible, which is obviously all being slowed down by this. Anyways, the point being, we can't call ourselves a church until we can get the legal status, and we can't get the legal status until blah, blah, blah. So anyways, we're just starting to talk to them about wanting to do a Sunday Bible study as well, and there was an enthusiastic response. They're wanting to get involved, but it's very hard to grow a church when you're told, you need to isolate and not reach out. So that's just something else that we're going to have to consider going forward as to what's next. All right, so two quick things I forgot to include. Number one, another thing affecting us is the sheer amount of tourists that come to this country. In a country of 5 million people, we have 2 million tourists a year. And so, on the one hand, like, we do want to maybe consider limiting that because of the potential for bringing the virus. On the other hand, like, that's a huge part of our economy here in Costa Rica. And so, that also will affect things going forward. And also, I wanted to mention that Costa Rica has banned all public gatherings. They have banned all sporting events, or not banned them, but they'll be played behind closed doors. And they've canceled all concerts, anything on a large scale type gathering. And also, we should be finding out today if they are canceling school. So, anyways, those are two more things I meant to mention that I forgot to mention. But anyways, I think I've covered all the important things and just kind of telling you where we're at and what's going on with us. We're not scared. We're not living in fear. We trust God, but we are trying to protect ourselves and to protect the people around us by being smart and being safe. So, anyways, I hope that that maybe helped you understand what's going on. And if you have any questions, feel free to ask them. I'll be more than glad to answer them for you. And thanks for watching.